He's a younger gentleman in his 40s. He is positive for COVID, and he is on the maximum amount of settings on the ventilator that we can put him on 100% oxygen.
Critical care nurse Laura Mailing will spend her shift focused on this one patient.
He FaceTimed his wife and his kids before.
Her patient is among the sickest in the hospital and requires constant, complex care.
We give them sedation, and we have to manage their blood pressure, and giving medications like that can only be given here in ICUs.
The shifts are grueling and the caseload can, at times, feel hopeless because despite Laura's best efforts, many patients won't survive. And they'll die with only Laura by their bedside.
My patient was very young, in her 40s, and she passed away of COVID. And it was like we felt so helpless because we were doing everything we can, and it still wasn't enough.
Laura is weeks away from maternity leave. She spent much of her pregnancy in the ICU caring for the severely ill. Filling her shoes will be challenging. In addition to beds and equipment, there's a need for specialized staff. Right now, they're just not available, and yet the COVID patients keep coming.
We do have redeployed staff that are able to help assist the nurse in providing care, so we're able to stretch that model a bit. The question, of course, is, how far can we stretch?
More than a year into the pandemic, they're stretched thin. But even before COVID-19,
Ontario has the lowest RN per population in the country.
The CEO of the Registered Nurses Association of Ontario says she has long warned of a major nursing shortage in the province. Now, in the midst of a health crisis with a system on the brink, it's become clear this precious healthcare resource is lacking.
800 new beds multiplied by 4 each, plus all the others, right? Plus we are putting now people in other places, and you are going to deplete every single other unit.
Overnight was 600 mils.
As Laura gets set to leave the hospital and focus on expanding her family, her absence will be felt here as Ontario ICUs become ground zero during this third wave of the pandemic.
We're just treading water here in the ICU. We're just managing, we're just getting by as well as we can.
Caryn Lieberman, Global News.